The mouse is like just on the screen. If you need to go back to the screen, with that, it's. And to get this whole thing, the space bar should work. The space bar somewhere or by the best.
That's true.
Well, that's what I.
So they can just sell any hardware.
Yeah, yeah. And
All right.
Hello, everyone. Good afternoon. Good afternoon. Let me hear you're awake. Come on, a little bit more spirit, please. Good afternoon. Good. My name is Ryan Rowe, and I'm pleased to welcome you today to the session entitled 2 with 8, Scaling Safe Water for 2 billion people with $8 billion through household water treatment and safe storage. To begin the session today, we're going to start with a message from the Director of the Water Institute, Aaron Salzberg.
Hi, my name is Aaron Salzberg, and I'm the Director of the Water Institute at the University of North Carolina in Chapel Hill. Welcome to the 2023 UNC Water and Health Conference. I'm very sorry that I couldn't join your session today, but really excited to see the attention that household water treatment and safe storage is getting this week. Look, we all know the challenge. Today, as many as 2 billion people across the world lack access to safely managed drinking water. We also know that for a vast majority of people, continuous pipe service on premise is the only long-term sustainable solution towards achieving SDG targets on safely managed drinking water. Achieving these targets would take billions of dollars in new investments, which could take several years, perhaps decades, to mobilize. In the interim, we still need to provide water that is safe for people to drink. We also need solutions that can sustainably deliver safe water for those that are hardest to reach and that provide an added measure of safety where existing piped or decentralized systems do not yet provide safe water 24 hours a day, 365 days a year. This is where household approaches to treating and safely storing water can come in. If used correctly and consistently, proven methods for removing or inactivating pathogens at the household level has the potential to provide an interim and scalable solution to improving water safety while we work to increase the coverage of safe, pathogen-free, and reliable piped water. We don't have to wait to provide water for those without. As we work towards safely managed services for all, HWTS can fill the gap. So I very much appreciate what you'll all be doing here today. Thank you for coming to UNC, and let's start a movement to get safe water to every person, everywhere today. See you in the hallways.
So, ladies and gentlemen, our esteemed panelists, guests, and friends of the Water Institute, it's an honor to be here today as your moderator to discuss an issue that continues to affect over 2 billion people worldwide: the lack of access to clean and safe drinking water, as you know. As pointed out by the World Health Organization in 2022, an alarming number of people still use contaminated water sources, which poses a grave threat to their health, their well-being, and their dignity. While we've set ambitious targets as a community in the wash sector, with the current pace and funding, these 2 billion people will not have safe water by 2030, and perhaps not even by 2050. Were any of you at the JMP session this morning? Hands up, please. All right, a few of you. The headline numbers. Can anyone just sort of remind the room? What were some of the headline numbers coming out of that? Were you listening? All right, I know it's after lunch. We're all kind of in a food coma here, but So one of the numbers coming out of that session was that in 2015, 69% of the global community had access to safe drinking water. But as of 2022, that number had increased to just 73%. So over a 7-year period, an increase of 4% in the global population now has access to safe drinking water. By my standards, that's not fast enough. The simple fact of the matter is that we need to accelerate our actions. In fact, another alarming number that came out of the session is that 3/4 of countries around the world, or 150 countries, will miss the 2030 targets. This glaring fact underscores the urgency of our gathering today and the need for innovative, game-changing solutions. Household water treatment and safe storage, a strategy which has a soft spot in my heart, as many of you know, or what we call affectionately HWTS, has emerged as a cost-effective solution in addressing this issue. That fact has already been known for a number of years. Through methods such as boiling or chlorine treatment, tablets or solution, and water filters, families can ensure that their water is safe for consumption. In particular, the household water filter market could be described as thriving among the more affluent in countries around the world. So a pressing question remains: how do we ensure that every person on the planet, irrespective of their income, their race, where they live, has sustainable access to safe drinking water at an affordable cost when they need it, and without waiting years for that reality to become true? The 2 with 8 proposal offers a very promising approach, suggesting that with an $8 billion investment to scale up the use of point-of-use water treatment, we could secure safe drinking water for 2 billion people. That averages out to about how much per person? Who's listening?
$3.
$4. Close. The strategy revolves around 3 pillars. Widespread awareness creation.
Well, of course, yeah.
You gotta keep it light, right? Keep you guys awake. So widespread awareness creation, establishing supply chains for affordable water treatment products. And third, subsidies for the underprivileged through strategies like vouchers, or like what we know maybe as food stamps, for example, things like that, to ensure market sustainability. Today, our objectives with this session are multifaceted. For our distinguished panelists, we want to critically discuss, refine, and hopefully converge on the 2 with 8 idea. Second, for our audience, we want to instill and remind of the importance of household water treatment and safe storage as a strategy to achieve safe drinking water for all. We want to share lessons with you from 30 years of triumphs and successes and tribulations in the sector, and consider the launch of a global initiative like a Water Filter Alliance. You'll hear about a variety of successes and failed experiences from different countries in Asia, Africa, and the Americas. These shared experiences, combined with our collective will and our energy and our experience, can chart the way forward. It gives us a roadmap. Together, in this session, we want to invite you to a dialogue. We invite your critical questions, your challenges, so that we can contemplate ways in which we can transform the wash sector together. We want to invite you into collaboration, find ways to trigger large-scale awareness and information campaigns, and trigger the establishment of sustainable supply chains for water filters and other household water treatment products, and also create an effort to advocate for the use of subsidies and vouchers to reach the poorest of the poor. In closing, this workshop is a call to action for all of you. And the single action that you could do tangibly today to walk away from is to sign up for the Household Water Treatment and Safe Storage Network to get access to more information. You can find that on the CAWST webpage. Other than that, you can form collaborations, engage in dialogue, and ask questions and form a network. Our first panelist today is Nikki Beach. She is the Director of Governmental, Non-Governmental, and Uniformed Services under the Government Affairs team of NSF International, which is based in Michigan. She works on behalf of NSF International for the World Health Organization to develop the ongoing international scheme to evaluate household water treatment products around the world. This is an initiative that has been in the works for 10 years and I believe is now in its round four.
Round four ended, yeah.
So NSF International is an accredited standards and certification organization, and Nikki has been with them for over 25 years. She is the person you want to speak with if you have questions about the performance of a variety of household water treatment products and technologies. Nikki?
Thank you. What are you doing? Hard to follow, Ryan. IT knows I'm gonna need help. Maybe. Not. So far. Where'd it go? Yes. Yep. All right. Who has faith in me now? All right. Thanks, Ryan. I appreciate that introduction, and I'm grateful to be part of this session. Again, representing WHO and talking about the work we've done with the International Scheme to Evaluate Household Water Treatment Technologies. We just finished round 4. And so we're going to talk a little bit about that. But to get started here, you know, WHO, why did they make an investment in household water treatment technologies? And the reason for that is, even though Director Aaron talked at the beginning about this ultimate goal for pipe supplies to all folks in the interim, household water treatment technologies represent a really great solution for that 1.8 billion without access to safe and reliable drinking. And so when used as a primary intervention, it can reduce diarrheal disease up to 41% in the populations most at risk. And that is only going to be realized, however, if effective methods are used. And what is an effective method? That means that they'll be used correctly, consistently, and by products that actually do work as claimed. So, all right. So how do you select a product that works? How do you select an effective method? That is really, really hard because there is a lot of diversity in the market. First of all, I'm sure everybody in this room knows there's a lot of different technologies that can address purification of water. You have physical barriers, all kinds of different filters. You have different kinds of disinfection, whether it's chemical disinfection, solar disinfection, thermal disinfection. You have combinations of those technologies, and thank goodness there's also always new and emerging technologies, but having all those choices makes it kind of difficult. So what you need to know is some kind of health-based performance evaluation to help guide that selection. You need to know a little bit about what your issues are, right? And currently, there's a gap in that a lot of countries don't have health-based regulations, and they might not have the technical capacity in country to do those evaluations according to the WHO scheme. And so for that reason, in 2012, WHO established the International Evaluation Scheme to evaluate household water treatment technologies. And the scheme has 2 important broad components to it. The first is, and what we initially put a lot of energy behind, was this idea of the promotion of independent and consistent laboratory evaluations of products when new. And so what you had there was prescriptive protocols, so everyone under different technologies were being evaluated the same kind of protocols and criteria, transparency around what those look like. And then the second piece of the scheme is this idea of building national country capacity, and that's both with building regulatory capacity in country to regulate what is moving in countries, as well as helping with strengthening technical capacities to bring those evaluations in country. There we go. So in talking about the scheme, I know for years now, a lot of you have probably heard information about the scheme. A little refresher. Let's first talk about what a household water treatment technology is defined as under the scheme. It's a product used in households or similar settings to remove microbiological water contaminants that may pose health risks. And I kind of emphasize microbiological there for a second, because we're all aware in this room that chemical contaminants are of different types, are problems in different parts of the world. But I think we can all agree that microbiological concerns are shared by everyone. And so that is why the scheme was limited to microbiological evaluation. And the microbial groups that are evaluated under the scheme are the three groups that are issues in water. So bacteria, virus, and protozoan cysts. And additional to that, like the aim is to guide WHO member states in procuring UN agencies in the selection of technologies and support national governments in a number of evaluation related functions. A little bit what I talked about here. So the scheme, the WHO scheme, a little bit different from what I'm used to at NSF International, my employer, where the audience is generally the consumer. The WHO scheme's intended audience largely is those entities that are making decisions about what can be in that country or what is being procured and distributed maybe after a disaster or regularly. So national certifiers, regulatory authorities, and then also implementers, but also researchers and manufacturers who are developing new kinds of solutions. It provides some guidelines around expectations of what these types of products should be able to do. And again, I mentioned earlier, with the scheme, the goal is to, with time, move it to something that the country is now managing themselves from a regulatory as well as a evaluation capacity. All right, so where we're at now, we just finished round 4. We're writing up that report, so that should be published soon. Rounds 1 and 2 are reports that are available. I really suggest you go to the WHO website. You'll see the link at the end to dig into the details. I'm not going to go into detail here, but 3 and 4 evaluation should be out soon. So without getting into this too deep, what you have here is we have received 100 expressions of interest to date, and we've evaluated 51 of those products. And what's great when you look at this is you see that there's a lot of different types of technologies that were evaluated. That's great. One of the big things about the schemes is the idea of having options. We talked about making sure you're able to select something that's right for your context, and that means what will work with your water issues as well as what will be used. And so it's great to see that variety of options. You can also see here that there are a large number of products that met WHO criteria, either as a single star for targeted protection, which means it did 2 of the 3 microbial groups, or a comprehensive protection where it did all 3 microbial groups, either to a 2-star or 3-star performance of log reduction. What you also see here at the beginning is this column of 8 products that did not meet any of the star criteria classifications for the WHO scheme. So these are products that are commercially available that did not meet the criteria and are thus receiving little or no protection. Keep an eye on that. We're going to mention something very interesting about those in a second here, and it'll come with a key takeaway. So I think, like with a lot of things, the takeaway messages, the surprises are just really very, very interesting. The first key takeaway message here is that manufacturing quality control is highly variable. This was very fascinating. When the WHO schemes are performed, they're performed on 3 units, or there's 3 products that are tested at once. Each of those must meet or exceed performance criteria to consider getting a performance classification of 1, 2, or 3 stars. What we saw in 6 of those 8 on the previous slide that I said did not meet a classification were issues with manufacturing quality control. So 6 of those 8 actually had design or formulation that was actually robust enough to meet the performance criteria, but due to manufacturing inconsistency, it did not. And it failed to meet the classification. Super quickly, what's important about that and what the scheme did here is it gave that information back to the manufacturer so that they were able to tighten up their manufacturing controls. So that was an unexpected outcome valuable piece from the WHO scheme. Takeaway 2, variations within the same technology type. You know that certain kinds of technology should have the ability to have a certain kind of performance outcome, but how that's packaged into a product makes a difference. So you really have to take a look at that in the laboratory. And there's a really great piece on that in membranes in one of the reports. So I encourage you to take a look at that. Chlorine is not a simple evaluation. Takeaway 3, in the laboratory, it was difficult because we had to think about those waters with respect to the type of organic matter and the chlorine demand to make sure it's reflective of actual use. And in the field, same thing. It's not just about the turbidity. The user has to know how to use chlorine correctly. Understanding water quality and technology limitations are important. I'm running out of time, sorry. This is all in the reports. Having 2 waters and seeing where the weaknesses are for various technologies if the water is of lower quality, very useful stuff. And use instructions need to reflect best practices. And I think I've seen some really great changes in use instructions where there's more clarity, maybe using pictures, making sure it says to add stirring, multiple languages, that kind of thing. A lot of this is repeat. Looking ahead, there's going to be a lot more investment now, moving away from the laboratory to strengthening the in-country regulation and technical capacity. Here's some links to where you can get these first round reports, a lot of great stories in there that came out of the scheme, a lot of suggestions maybe for manufacturers. Thank you. Are there any questions? I have about a minute or two for a minute, maybe for any clarifications.
Online questions too. I think.
Oh, online too, yes. Oh, we got lots online.
Do you want to help?
Let's see. Yeah.
In terms of dissemination of the information and how it gets used, there's a couple different questions. One is who working with the different water regulatory and government implement? In our session this morning, we heard that in Indonesian Bangladesh, water filters are not in the government regulations at all. And so there is no ability to get approved otherwise there.
Yeah.
And the other one is there any effort for making the WHO results or who says this thing works available to consumers rather than historically only sharing it with NGOs that have interaction.
Right. Well, I'll answer the second one first because that's pretty easy. All that information is online on the website, so you can go in there. It's also in the reports that you can show how each individual product performed. I know that's probably not as available as you'd like it to be.
Low-income consumers in Bangladesh are definitely not.
And maybe we can have a conversation afterwards, how we could make that more available. That would be great information because that is how the scheme is going to have impact, is if people know about it. And then the second question, with investing more now, moving away from having a lot of our resources tied up in the laboratory evaluations, getting a good picture of what's out there, what that could look like, different types. Now we're moving to strengthening in-country, doing their own work, right? Technically as well as regulatory. And there's been a few countries that we've started with who either have some foundation already of a regulatory program for household water treatment technologies, even if it isn't robust health-based, but something, or a very strong desire. Those are good places to start engaging with in-country stakeholders to try and build those programs and assist however we can. Does that help?
So the broader one that would be really simple is allow people to put the WHO logo on their product. Because that's what consumers want. They don't want to look at a website. They're going to tell you that a website was fake because they want it on the product. And they want to know the government allowed to use it.
Yeah, I understand the need for that. There's some complications with that from the WHO side there. There are lists, and I don't know, I think it's won't move now because I'm in a chat room, but there are lists that WHO products are on around large procurement agencies. So products are getting put on those lists for like UNICEF, for example, so that they know they've gone through the scheme and what their performance outcome was. But happy to talk to you if you have suggestions for how it can be more available. Yeah. Sorry. Okay.
So this is a great way for us to start this session. And the reason why is because WHO is the lead global advisor to national governments all over the world on health system strengthening. In particular, the use of household water treatment products that can have implications for people's health. And that in a fragmented market, that's why you need strong regulatory authorities in national governments. Nikki, it was really gratifying to hear about the success and progress of the scheme since my time with the network 10 years ago. I just remember when it was just getting started in 2011. That's really cool to see how far you guys have come. So our next presenter is Marcio Bacco. Marcio has been with the Center for Affordable Water Sanitation Technology since 2019. That's the organization I mentioned at the beginning of this session. If you want to sign up for the HWTS network, you can find the links on their website. So Marcio leads CAWST's work on household water treatment and safe storage. He holds a PhD in civil engineering and water resources, and a master's degree from the Federal University of Ceará in Brazil. His expertise includes environmental sanitation, a number of other different wash sector activities. I also learned just prior to the session that he's a fan of kite surfing, just like me. Marcio, welcome.
One more housekeeping issue is at the end of the presentations, we have 30 minutes for discussion. We'll get the time to this.
Yeah, there we go. Thank you so much. Let's start. Thanks for the introduction. And thank you so much, Hank, for inviting the network to be here presenting today. Yeah, I'm Brazilian and I learned English in Canada and now I live in Texas. So my accent, it's gonna be a little challenging for you guys, you'll understand it. But yeah, good luck. So yeah, I'm a knowledge and research advisor at CAWST, and I'm going to present a little bit about the network, the HWTS network for you guys. So let's see how everything started, the network. In February of 2003, around 30 organizations met together, people from the public sector, academia, nonprofit, got together in Switzerland and to establish the International Household Water Treatment and Safe Storage Network. It was sponsored by the time by WHO, and the idea was to provide a space to share information, discuss, and promote group and individual actions. But what was the rationale behind all of this? Why start HWTS network? So at that time, it was back in the 90s and 2000, several studies evaluated the health impact of HWTS technologies and products. The field of HWTS was undergoing rapid evolution, was growing really fast, making it challenging to keep up the pace. So new products and options were available in the market, many research, but we saw that it was a little bit fragmented and it was not really accessible to everyone. So besides that, the different stakeholders were not connected. So it was clear also the need for new regulation policies. So the network has formed to connect stakeholders, coordinate the efforts, and organize the sector. Let's see a little bit here the timeline. So the network was founded in 2003. We had at that time 30 organizations. WHO was the host. In 2011, UNICEF joined the network alongside UNC, and at that time it was 150 members. And then in 2020, CAWST joined the network. We had like 390 members, I believe, at that time. Today we are 1,400 members, and you can see the growth, right? It's really good to have not just people from America, because in the beginning it was most people from Europe and America. Now 70% of the members come from Asia Africa, and Latin America. So why HWTS must be part of the path to achieving SDG 6.1 or to have safe water? So the network was built on the evidence that household water management could significantly contribute to meeting Millennium Development Goals at that time. And today we have more evidence that HWTS must be part of the path to achieving safe water. Regardless of the water source, studies have indicated that in low and middle income countries, the microbial water quality often deteriorates between the point of collection and the point of use. In the graph on the left here, you can see that countries in Asia, Africa, and Latin America, 46% of the population used drinking water free from contamination at the point of collection, while only 22% were using drinking water free from contamination at the point of use. That report, that number was back in 2016, but this report is the report from, oh my goodness, I got so anxious when I got see those signs. 3 minutes. I need to, okay. Sorry. So, no, I'm just kidding. Let's come back here. So today, what do we have so far? There are so many systematic meta-analysis reviews that indicate that has comparable health impact, that household water treatment has comparable health impact to piped water system. So reduction of diarrhea was 52%, I believe Nick showed that, for water supply in premises piped, while 50% using filtration technologies at the point of use. So it's pretty much the same when we think of piped water solutions and filtration solutions at point of use. So it's pretty much comparable. When you think of HWTS, we should bear in mind that there is no silver bullet. That's what we think as the network. There are several factors that should be considered to make sure that the water is safe for drinking. An important approach that should be more emphasized when implementing HWTS is a multivariate approach. Multivariate approach is something new. Actually, we kind of copy from the centralized and the network supply system. What we try to put is more barriers. So we make sure that the water is safe when you're drinking. And we're not talking about the treatment itself. We also believe that it needs to be alongside water source protection, safe transportation, and safe storage. However, the technology itself will not produce the health outcomes. That's what Nikki has also mentioned. The correct and consistent use over time has proven to be as important as the technology performance. It's not just a technology that you're gonna, okay, I have the best technology ever in the world, I'm gonna have health outcomes. That's not what's gonna happen. You need to use correctly, consistently, and continually. So there are some studies that have confirmed this, including models suggesting that the 2-stars products classified by the WHO scheme, when used correctly and consistently, are more effective than the 3 stars used inconsistently. So it's not just about the performance itself. So in this slide, I just want to reinforce the importance of the correct and consistent use of HWTS for a positive impact on people's health. Today, the HWTS brings together practitioners, academics, policymakers, working on water quality initiative. The network members can share their challenges, learn from each other, and stay up to date on research and industry trends. When the membership is free, and when you join, you can access the network's discussion forum to stay in touch with members. You have access to events, meetings, you can submit your projects, your experience, and you can collaborate to produce white papers, sanitary inspection forms, monitoring toolkits, several other products and services. This is just a list of the products and services that the network has delivered, has provided, including toolkit for monitoring evaluation, white paper on market-based approach. I suggest everyone to take a look at this one. It's really aligned to our discussion here, and other services and products. We also have a discussion forum called Knowledge Point. Here it's a web version, then you can take a look at an app. You can look at, those, both these devices. There's also a knowledge base called HWTS knowledge base. There is a catalog, HWTS catalog. There are projects. You can see projects, country focus page where you can choose the country and see products that have been implemented there. And with my last slide, this is my last one. I want to invite everyone to attend the annual meeting. The 123 annual meeting will be held on November 8th, when the HWTS network members will come together and in an interactive virtual meeting. So there is no in person. You're gonna be all together online to learn more about the latest update on the network, the national chapters, share your ideas, and celebrate the 20 years of the network. This year, it's the 20th anniversary of the network. And I'd like to thank everyone for this opportunity. And if you use this QR code, you can just go, takes you directly to our become a member of the network. Thank you so much. Let me see if I have questions online. If not, we can take the questions in the room. For now, I don't have any questions online. Hello, everyone to join. No questions online. Oh, just one more thing. We have a fact sheet here showing the 20 years of the, celebrating the 20 years of the network. So please just distribute and take one fact sheet. Thank you. If there is any question from the room. Yes, there is one question there. Oh, now in Portuguese. No, I'm sorry, guys, you're not gonna understand. So she's speaking to me in Portuguese. Does anyone else here speak Portuguese? Yeah. Oh, a lot. So never mind.
Do you think there's anything that made the shift towards getting such a high percentage of HWTS members in Asia?
Yeah, there was a hard work on promotion and also when we went to the field and talked to our partners and clients in the field, it was a big promotion on the network, so the benefits that once you join the network, what you can get out of it. But before it was more focused on academia and those big organizations. But the grassroots organization, they were not seeing the value of it. And once we showed them what the network could provide, yeah, so I'm going to join it. So that's what happened. Yeah.
So it was light work.
Yes. Thank you for the question. Mark, please.
Mark Sapsy, University of North Carolina, and Aquagenics LLC. So my question has to do with how the network can better attract and engage with governments. Since governments are key to local country level involvement with HWTS and should be as potential regulators, monitors, or governments, and so on. It sounds like there are not a lot of governments that are network yet. How can they be invited? Is there a process that could be used to connect with them? Is that something that the network can do itself as an entity or in partnership with WHO, NSF International? How do we reach them to get them involved? As has been pointed out, there's some countries like Bangladesh that have lots of POU devices.
Yes.
None of which are regulated.
Yes.
And I've been in Bangladesh and I've seen some of those products. Some of them illegally have NSF approval on their labels. And it's not a real approval, but they've done it because no one's preventing them from doing it.
Yes.
So what can be done to get better connection?
That's a great question, Mark. Actually, what I would like to say is that we need to show the value of the network first. They need to see how the network can contribute to their work in country. So it's not just how we can engage them, but the network itself needs to show the value and the potential and how we can help them. So I believe that the network in those 20 years, we have supported some initiatives like providing more knowledge on regulation policies. We have some work on that. We have some resources on regulation policies, how we can implement that in our country. So I think that the network should be more active in showing the value of it. And we are all members. I mean, once you're a member of the network, you should also, share that, hey, we have this. Let's share knowledge. Let's be together in this network, so we can make sure that in country we can leverage and scale up HWTS. Yeah, I think that's it. Thank you. Oh, can I take to the end? We can talk later because we're kind of. Thank you so much.
Yeah.
Thanks, everyone.
A lot of windows to close. Hold on. All right. So we just heard from CAWST, which is a partner to WHO in the International Network on Household Water Treatment. So we've heard from the global advisor to regulatory authorities nationally. We've now heard from the main partner on communications and advocacy, housed in Calgary, Canada. And I think just the fact that over the last 10 years that the network is now able to communicate in Spanish and French is just really encouraging to see that membership has expanded, in Asia and Africa and the Americas. To be able to be more inclusive and to reach different audiences, I think is super important. My only question, Marcio, when will your communications be available in Portuguese?
It will. We are in progress. We're there.
Yeah, because I think those languages, right, can really help to reach national governments in the, with the information that they need to be able to feel like they can develop policies that can promote regulation. So I think that this is absolutely brand new strength of the network that wasn't around when I was here at UNC as a graduate student, and it's really exciting to see that happening. And one of the things that the annual meeting, November 8th, don't forget, that's a fantastic opportunity to show up and learn more. And one big soundbite that I heard from Marcio that stayed with me was the idea of the 3 C's, in particular, that 2-star products, when used consistently, are more effective than a top tier or a 3-star product that is used inconsistently. And so if you're a practitioner working on household water treatment and safe storage, ensuring that the folks that you're working with in communities are using those products correctly, consistently, and on a continued basis is so important to delivering that health impact. So we'll move on to our next panelist now. Our next panelist is Liselott Hiedrich, and she is the co-founder and director of Nazava Water Filters. She's also a development expert in microfinance and women's empowerment. Nazava has operations in Indonesia, Kenya, and the Ukraine, and also works with partners globally like UNICEF. I'm not actually sure where you're headquartered though, but that's in Indonesia. Okay, so long way you've traveled then. Yeah. So one of the products, it's one of the few products that's been tested by WHO for bacterial removal. And it is a profitable business, which is exciting to see this market-based solution functioning because it validates the household water treatment sector as a whole. She's won a number of awards for her work in leadership in social innovation and development. And she's a public speaker and a panelist on WASH and poverty, and also led graduate course instruction at George Washington University. Liselott, your turn. Thank you. Let's give her a big hand.
So, good afternoon, everyone. It's an honor to be here. Thank you very much, Ryan, for the nice welcome. Whoever of you has been in Africa, can you raise your hand? All right. And if you have drinking water from the tap, can you raise your hand? in Africa?
With or without a filter?
Without a filter, directly from the tap. Who drinks water directly from the tap in Africa? Okay, I see 2 hands, but it's not the majority of the people in the room. So I think this is important. And I've asked the same question in Kenya to people working in public health, and exactly the same thing happened. Only 2 people dare to drink the water from the tap in Nairobi. Yeah. Whereas here we are together to talk about water and health. And what is the primary health problem we have with water? It's diarrhea. Yearly, 500,000 people die of diarrhea. Yeah. This equals 23 crashed Boeing 747s each week. And this is a silent death that has to stop. And it can be stopped through household water treatment systems that are affordable, attractive, and available to those lower income households in Africa, Asia, and Latin America. So I was living in Indonesia and doing relief aid after the tsunami, and my well was contaminated. And I looked for a filter and I found none. So I just made my own filter, and then my friends and neighbors said they also needed one. And that opened my eyes to the problem that so many mothers, in especially rural areas, don't have an opportunity to provide safe water to their children. And they spend too much time looking for fuel wood. They spend too much money bringing their kids to the health clinic, and still they see their children suffer from diarrhea. So that's why I found Nazava in 2009 with the mission to provide safe and affordable drinking water to everyone, everywhere. And now I'm trying to figure out how to change. Oh, wait, I have to go to this thing. Yeah. So we just discussed this, 24 Boeing 747 each week, yeah? It has to stop. A big problem that I realized by living in Indonesia, where I live in a city center, even I do not have connection to a pipe. I use well water, and my whole neighborhood uses well water. In Indonesia, only 30% of the 270 million people are connected to a pipe, and only 9% uses water from the pipe on a day-to-day basis. And a big problem is that many subsidies that are available for SDG 6 actually are captured by the 56% wealthiest people. Yeah. And only 6% is captured by the 20 poorest people. So the subsidies that are available to provide safe drinking water to everyone, they are wrongly allocated. Yeah, and they benefit the rich. Another problem that I've noticed whilst living in Indonesia and traveling to Africa regularly, in the north, we are used to the electricity grid, a wonderful centralized solution. We are used to pipe gas connections, at least in the Netherlands, a wonderful centralized solution. And we are so spoiled with our piped potable water. In the Netherlands, we flush our toilets with mineral drinking water. In any school, you can drink water from the tap in any bus station. But these solutions are super good, but they're very expensive and very difficult to maintain. And you've seen in Africa, solar lamps are booming. These are decentralized, market-based solutions that now empower households to take care of their own light in their house. Yeah, clean cook stoves that reduce indoor smoke. They have boomed as well. They empower households now to cook using more safe technologies. And household waters can do the same. They can be a very good interim solution to leapfrog the need for pipe solutions. Because those rural households that I serve with my water filters, by the way, you can see an example over there if you're curious. Those households that I serve, they don't have a pipe solution. And I wish for all of them to have a pipe solution, but I'm not sure how long that will take. Yeah, so that's where decentralized household solutions come in. And there is a market. If you look in the global south, NGOs provide these products, but those are commercially not available. Yeah, and these are products that actually are commercially available. And many of these, well, around 6 of these actually have already been tested by the WHO. But that's also a problem. Only 6 of the 34 that I looked up have been tested by the WHO. Yeah, and these products are really trying to sell directly to the end user. Yeah, and they are long lasting. The capacity of these products is immense. Our filters can purify up to 7,000 liters. They last up to 3 years. The ceramic pots can last up to 4 years. Yeah, the Folia water can purify 20 liters, but like one filter only costs 20 cents. Yeah, and the continued use rate of the ceramic filters and the pots is more than 90% in the first 1 to 2 years. So it's also a sustainable and durable intervention. Yeah, here you can also see the cost per liter are much lower than bottled water, boiling on charcoal, or using LPG. And also what you see is that these products are responsive to market needs. Most of us started with buckets. Yeah, the product has to be cheap and affordable. Oh, those poor people can't pay. But they want to have something attractive. And all of us have started to move towards more attractive products. Now what we are trying to solve is now how to serve the lower income households by providing payment schemes. So we partner with microfinance institutes that are already reaching the same target markets. So now households can pay in installments. Yeah, so most of the water filter companies that I talk about are targeting the rural peri-urban women. They're a member of the MFI and they earn less than $100 a month. And we do not only contribute to SDG 6, although I think this is now debatable, but at least we are aligned with the mission of SDG 6 and we want to reduce diarrhea. But as we also generate carbon credits, we're also certified and acknowledged for the contribution to all the other SDGs that you see here. Yeah. Now, as water filter companies, we want to learn of other networks that have been very successful to boost the uptake of solar lamps and cook stoves. That are like our examples. So now we want to set up an industry alliance of household water filters, companies and manufacturers that directly target lower income households in the South through a B2C model. So actually we want to sell, yeah, because that ensures the continuous use rate of our end users. Yeah, so we really would like to see household water treatment systems to be included in the next GMP monitoring program after 2030, because I think it should be acknowledged that we contribute to reduced diarrhea. I think we can learn of how HIV has been curbed and COVID has been curbed by governments promoting condoms, governments promoting health masks, vaccines, and I think governments can do the same for now promoting decentralized household water treatments. And then there's a lot of other creative ideas over here. So thank you very much. I'm so happy to see so many people here in the room. And yeah, let's go this together. Thank you. Questions? Yeah. Oh, here in the chat. Okay, Q&A. I have to. No. How can we control the HWT chemicals here and there? How can we control the HWT chemical? Yeah. I'm not sure if I'm able to answer the question. How can we control the HWT chemicals here and there? And then in the chat. Okay. Sorry, maybe there are questions in the room. I'm not sure if I can answer this online.
Actually, even the questions in the room will get chance at 2:30 or 30 minutes or so. Now, 1 or 2 clarifications question can be asked. That was the plan from the beginning.
Yeah. Any
But
clarification questions?
Discussion.
Yeah.
Hi, Kelly from CARES. Exactly. But thank you so much for your presentation. I think that with filters,
you all need to acknowledge that they help so much with chemical contaminations as well. It's not just like diarrheal disease and not just like, anyway, so thank you. And filters, I think, are the way to go. And just so you know, I don't know how often you've studied the US in terms of consumption of water, but our water is safe in terms of we're not going to get diarrhea, which you can tell, but at least 20%, sometimes in some cities it's more, rainfall water is a exclusive way of consuming water. And so I think filtration can help with the water treatment system, like being the answer everywhere.
Yeah, thanks for pointing it out. I've noticed like the demand for household water, point of use water filters in the US is also really growing. Households want to be empowered to control the quality of the water that they're consuming on a day-to-day basis. And I think we can learn from the US and now just see how we can facilitate that demand of households in the global south as well. Thank you for your comment. Yeah.
Thank you, Lisa. Okay, so we heard from WHO, then we moved on to CAWST, which is the convener of the network with the WHO and UNC, and now we've heard from a private sector player that has commercialized water filters in countries around the world. So you can see here what we're doing is we're connecting the dots for an ecosystem that can help promote the scale up of household water treatment and safe storage around the world. Lisa, there were a few things that you said in your presentation which really struck me. The first was that allocation of subsidies tend to go towards the rich. And so I think one of the things that needs to be explored here, perhaps in concert with researchers and policymakers, is there a more effective model for ensuring that allocated subsidy dollars are reaching the targeted individuals in an effective manner? The second thing that stood out for me was that decentralized solutions could be a game changer in developing countries, leapfrogging some of the paths that we've taken. So for example, clean cook stoves, solar lamps, and container-based sanitation. Could there be a roadmap for household water treatment and safe storage as well? And the third thing that stood out for me was this really compelling proposition to create a water filter alliance. Lots of private sector entities create industry associations so that they can build trust in their product, so that they can enter into new markets and learn from each other. Why couldn't that also work for water filters? It's worked for other sectors, and I think that this is a fantastic idea. We'd love to have your contributions to how some of these ideas could be addressed. You all are welcome to contribute to that dialogue. So for our next panelist, we're going to hear from someone who has, I have had a long relationship with. He's been a friend and a mentor to me, Henk Holtzlag. He is the advisor to the Meta Smart Center Group, which is a group of smart wash centers in 10 developing countries around the world, who basically look to train individual entrepreneurs in these countries on how they can commercialize low-cost technologies for wash. He has 3 decades of experience in rural water supply, mostly with failures, but now increasingly with success, which I think is obviously a testament to his quest for learning and continuous improvement. Henk, if I'm not mistaken, you were also knighted by the Dutch government, is that not true?
You're not mistaken.
Henk, I was honored that he invited me to moderate this session today. He's been a mentor of mine since my time at UNC, a friend of mine, and he's been instrumental for launching my career in the wash sector. Henk, please.
You're probably faster than I am.
Which one is your?
2 a day. So I have another challenge. We should start our discussion at 2:30.
Yeah.
So I have -1 minute.
I'm sorry.
So I will do it.
I think you should focus
So
on
fast.
key points, maybe 4 or 5 minutes.
Like, I can't.
Look at that.
They should.
Then I would like to wake you up if you were asleep with a proposition. So the most cost-effective option to reach the goal, safe drinking water, not talking about SDG 6.1, safe drinking water for all is
How's water treatment? Who would agree with this proposition? I see 6.5. Okay, growing. No discussion, we will see later on. We know the reasons for contamination. In urban areas, it is the problems with the water systems. And I think this is one of the big elephants in the room, as Lieselot asked the question, who drinks water in Africa from the pipe? Only 2 people. We all know, utilities don't like to admit that they cannot deliver safe water for 24/7. So there is an idea that we will explain later on. There is a study of the WHO already 2007 that clearly indicates what the potential is of treating household water level. So why doesn't it scale? Maybe it is because there were studies after that that said that household water treatment was not effective. We know studies that say that chlorine was not effective. It was effective technically speaking, but not in reducing diarrhea because of the mentioned 3 C's. If it's not used consistently all the time, it's not very effective. There were big projects with water filters given away for free, and there was no uptake of the filters. So this is where we can learn. And what we learned is in the past 10, 15 years, the business of filters has developed enormously. Go on website, Google water filters, you will not even know what to order. There's so many products available. So there's millions of rich people, even in Holland. People start to buy water filters, especially the inline filters. So filters is a rich man's solution. So if it is so easy for the rich, how can we get it to the poor, to the people that we want to reach? And we think one of the reasons is that we lacked the P of people. So again, there's 3 C's. A product has to be attractive, effective, and it has to be consistent to use, otherwise it will not work. And other reasons is that the lack of ass. The lack of awareness, supply chain, and subsidies. So awareness, if you're not educated and you see a glass of water, you do not understand that it can have bacteria that kill that causes diarrhea. So that takes long-term awareness, and that is the role of governments and NGOs. Long-term, 3, 4, 5 years on all the media. And there is examples of successful social marketing. We need to build up supply chain. If you stimulate filters and you have to go to the capital to buy a spare element and you live 3 hours away, you will never buy a spare element. So we need a supply chain of affordable solutions. And then the last one, the subsidies. It's an illusion that the people that earn $1 a day will even buy a $5 water filter. Forget it. They will not do that. So they deserve subsidy. And the experts all say a subsidy will distort the market. And this is again where we can learn from the past. If you target your subsidy, it does not even distort the market, but it can even help to build up the market. And there is experience with bed nets. By subsidizing bed nets, there now is a supply chain, a commercial supply chain of bed nets in most of the countries in Africa. So if you do this, if you want to give filters away, then do it with a voucher. So people can go with a voucher to a local shop, they pay $1 or $2. They should pay something, we think, but give them a support. So how to invest this $8 billion? Again, this is not one program, it's not one project, it's the idea. So the $8 billion can be divided in thousands of small projects. So we think you need at least 1/3 of this amount for the social marketing, the awareness. Around 10% maybe for the supply chain and 60% for the subsidies. And then the question maybe who's going to pay? Who should pay this? I think everyone that wants that everybody on the world has safe water should pay. Whether it's government, NGOs, private, doesn't matter. And another possibility is carbon credits. And Ethiopia may become an interesting example. In Ethiopia, we have 3 conditions that can make it a success. One is housing water treatment is in the policy of self-supply in Ethiopia. It's part of the self-supply policy, which means stimulate families to invest themselves. The second is there is over 100 utilities already that admit more or less that they cannot deliver safe drinking water. Sometimes they have power cuts of 3 days, you have to store the water. So they say, you're not sure, it becomes recontaminated, so treat it. And as a service, we will sell you filters. So they sell it as an additional service. And the last but not least, there is already local production of different filters, 3 different water filters, so people can choose. And over 500,000 filters have been sold in the last 5 years. So it proves that it is possible. And some are working with carbon credits also. And this is typically an NGO activity. The NGO Agro for All started and helped this to get this off the ground. So it is a promising model. Another half a minute.
Yeah.
So the first one was mentioned already, get it into the water safety plans. The second one is stop giving filters for free. If you want to help poor people, do it in another way. For instance, vouchers. We learned from Ethiopia and let people choose, give options. The alliance was mentioned already. I would like to see hands again. How many people would agree with the proposition? I see 3 more. So that is very fast. Thank you very much. Any clarifying questions? Or should we go to the Q&A?
Is the 2 or 8 billion, is that continuing 8 billion every so often to replace the filters, or is that
Good
the
question.
total cost?
The logic is it's a one-time investment. You get people to start using filters, and maybe again for the poorest you have to also pay or donate a spare element. But the logic again is that with this money, you start up a sustainable supply chain and you help the poorest with a one-time investment. Again, it's not a guarantee. The poorest of the poor still may need ongoing subsidy.
Right.
Is there a parallel with the condo market?
Sorry again?
Is there a parallel with the condo market in creating?
Well, you should never put a filter, use as a filter as a condom. Thank you. Sorry. Okay. A good face mask, condoms, these were given for free. So why not the same with water filters? Why does the water filters all of a sudden have to be something that people are paying for? Again, the middle class can pay, but the poorest, forget it, they need the subsidy. Mark?
So a couple of comments, I suppose one question. So there already was a model and the free giveaway of point of use water treatment technologies by the Safe Water System of CDC, who partnered with an NGO, I think it was ESI, and they bundled primarily either chlorine or the pure packets, disinfectant packets, in a bundle of items that were provided to people, including condoms, soap,
Right.
Women's hygiene products. And so there is a model for that. Of course, they promoted the things that were easy to just put in a basket. So those household water treatments, such as the chlorine tablets, were easier. On the other hand, they could offer a water filter as part of the package, except that the person or household would have to carry it home, but make it available. So that's a potential model to consider.
Okay.
And the other thing I would comment on is that in terms of marketing, obviously one of the big drivers of marketing of almost anything is a crisis, such as a waterborne disease outbreak. We now, for example, have an escalation of cholera worldwide in many parts of the world. The number of cases are increasing. It's probably going to get worse before it gets better. It's due to climate change and the failures that we continue to experience in sanitation. So it's opportunistic. It's a little bit sneaky, that we should be promoting point of use household water for that, because right now, WHO, UNICEF, and the Cholera Global Network, they only promote chlorination, and they primarily promote it through chlorinating consistently well pipe drinking water.
Right.
Why couldn't that cholera network likewise promote HWTS, either with chlorine or with filters or with other proven technologies?
Yeah.
It makes no sense to me that they have limited the scale and breadth of those options that are available. And I think they should be reminded that they have a responsibility to address cholera globally, and HWTS is part of the solution.
Yeah. Okay, so two short observations. One, if they offer something besides the chlorine products, the pure, the tablets, they should also offer filters and
Absolutely.
see what people like. Second, an emergency, yes, it can be an opportunity. Give you an example. The hurricanes in Nicaragua were the reasons that the local pot filter production started.
Yeah.
And now there is local production in 30 countries of these pot filters. So we need more emergencies. That's the bottom line.
Well, sadly, we will continue to have them, and they will get worse with global climate change, and
We have enough emergencies that we're right.
we have
Okay.
vacancies in countries right now where we didn't think we would before. So it's a kind of sinister reason, but it is an opportunity to still provide safe water, because those people who are affected by these conditions may have had some safe water, now they have less.
Yeah, no, I agree. Thanks. Let's keep it short with the question, unless it's burning. We'd like some more Q&A discussion on the panel, right? Thank you very much.
So I really want to give an opportunity for you all to just sort of throw questions out and really generate some dialogue here. What we have is the Household Water Treatment Network is a collective effort to bring together folks like you and how you can contribute to the advancement of this very laudable goal. Want to put something up?
No, it's just questions.
Questions on that. Okay, you're moderate.
Last questions.
Yeah. Do we have any questions to kick it off? Perfect, right here.
The first presenter
Could you introduce yourself?
Sam Schlesinger, Green Empowerment from Ecuador. First presenter mentioned a little bit the importance of best practices in the user instructions. I wondered if any part of the rating or any part of those publications actually discusses the quality of the instructions provided or provides some framework for how those would be best handled.
Yeah. Oops. Thank you. Yeah, thank you for that question. I was kind of rushing at the end there and I didn't get a chance to really stress that the WHO scheme absolutely emphasizes in the report, and anytime we talk, I had it at the end, the value of the correct and consistent continuous use. Which luckily after me, Marcio brought that up. And in some of the reports, it does talk a little bit about that, going into that and how to encourage that and what that might look like. But Marcio also put up a couple of publications that I think you might find really interesting. And you did mention them relative to the impact of behavior, appropriate behavior around correcting consistent use. Yeah, absolutely. And the overarching kind of message always is the idea is to bring that up. And again, you know, we're not ignoring correct and consistent use. It's absolutely important, but not overlooking the fact that there still is no point in distributing and asking people to use something that doesn't work.
Perhaps I should clarify. I just meant to ask, is there an analysis within the framework of ease of use, not to make?
Oh,
things
I'm sorry. Yes, yeah, part of, and one of the bullets on takeaway lessons, I think it was the 5th one, we were really surprised at one of the lessons we learned managing the scheme, the importance of taking a look at the use instructions provided with the packaging and the product, because the laboratories were instructed to use them exactly as written. And so sometimes things like stirring was left off, or wait times weren't clear. Or when chemical disinfectant, you should double dose because, you know, it might have more demand on the water. So yeah, that was a piece of what was looked at in reviewing the packages of products that came in. Obviously not a laboratory evaluation, but kind of in a roundabout way was, because we tested them exactly as the instructions indicated. And some of the things that we saw as really great, and I think I mentioned it for a second, having pictures to show how to use it, very useful. Having local languages, things like that are super useful to make sure they're used correctly.
Yeah. So now, one question from online. The question is, what would be a good source of this 8 billion USD? Maybe a mix of World Fund, private donors, and venture capital. So maybe, I mean, yeah, Hank said something on these lines, but once again, the question is there, a chance to respond to that.
Well, again, I'm not a financing person. I'm not specialized in those things. I would think it's quite easy. I mean, we have 8 billion people in the world, of which at least 3 billion are so rich they don't even know what to do with the money. It's trying to get, we need marketeers. We need marketeers of Coca-Cola. They're able to sell Coca-Cola all over the world. So we need 2 of these marketeers to get a worldwide awareness campaign and generate money. If the big banks, if the World Bank is not able, if they are too poor to pay this, why don't we ask, I don't know.
Yeah.
I'd like ideas from the audience. I don't know where the money is. I just think it should be there. We have enough money. The problem is not the lack of money. The problem is the money that is there is not used in the right way.
So let's throw that back to the audience now. Anyone want to react on that point or anything else you've heard so far today? Let's take Jim. Come back.
Yeah, it just seems like when you're talking about chlorine and filters, chlorine, single use, you really need the 3 C's. You have to go out and buy your chlorine every day and do this, but it's cheap. Whereas the filters are more like $20, $30, $40. And those things are 20 cents, but they're only good for 20 liters.
Yeah, but this is cheap also. This is 20 cents also. So this is comparable to chlorine. It's a little bit less, but more effective. Anyway, there is solution.
But I think what it seems like we need to be talking to the people that are potential donors to show how filters can be more cost effective even than the chlorine.
That's good.
Because if you just take a snapshot and look at cost, you're gonna go with chlorine because you think you get more bang for your buck with that. But I think, I don't think we're reaching the donors with the filters. I think they're looking more on chemical solutions.
So I think that's an interesting comment. Is there anyone here in the room that's sort of in the fundraising space or writes grant proposals from time to time?
Yeah.
What do you think that donors might want to hear with regards to raising money for this initiative? Any thoughts on that? Well, okay.
If I may say, 500,000 people die of diarrhea. I forgot the number of kids that are stunted, but in Indonesia, it's 8 million children that are stunted. Stunting means that your body is too small, your weight is too low, and your brain is not working similar to your peers. This affects the labor force of the future. This affects GDP. In Kenya, it's nearly 25% of children under 5 that are stunted. Yeah, it's the labor force, it's the GDP. So, anybody that wants to grow an economy on a sustainable basis has to reduce stunting. Because basically you're having like 25% of the population that is now not able to complete high school. Yeah, so it's an investment that governments have to make. At the same time, I think insurance companies can also fit in. Because of course, if families are healthier, they're not drawing funds from the insurance companies. So that's just my thoughts that I wanted to share.
So just to build on that, one of the things I've learned from my fundraising work is that if you want to reach donors with a message about how to support an effective intervention, you need to cut through the noise. You need to really make sure that your message is really clear. And I think that one of the strengths of the work in household water treatment is you have WHO acting to provide a unified message globally to all these national regulatory authorities. You have an organization like CAWST, which is helping to communicate on a consistent basis to get key messages across, right? And that can really help to unify the messaging and really help to weed out any of the noise or any of the information, the disinformation that donors may sort of be trying to maybe throwing their hands up and saying, I don't really understand what's happening in this sector, and this makes me really reluctant to invest in the sector. I want to focus on something where the value proposition is a lot more clear. And so I think the efforts here to kind of unify the messaging are super important. And I think it's important to continue that sort of thing.
So any more questions from?
No more questions from the.
There is one more question. It's kind of a follow-up one. How do local manufacturers come in to bridge the issue of supply chain? Who would like to take this question?
So we are the supply chain, so to speak. We supply the products. And we manufacture our products locally in Indonesia. At this moment, we are shipping our products to Kenya, but I'm fundraising to start local manufacturing in Kenya as well, so that we can serve the East African market.
Certainly, and I would like to.
But what I think is important, if we want to reach the lower income households, we have to acknowledge that we try to source products that are manufactured locally as much as possible to ensure sustainability.
I have a question. I do water wells, and I recommend that people filter the water after they test it. And if there's any problem with it, put a filter in. But one of the questions I get asked is, how do you know when the filter is no longer any good? And then I can say, well, you can't really tell, but if you have chlorine, you can use a test strip and see if it's still active. Is there a way that your filter, you can test your filter and find out if it is still good or?
Yeah, so I think that differs from product to product, but what we have on the product here is that we have a QR code. So in order to activate your warranty, you scan the QR code. Thereby we record the phone number. We have an after sales service team. So we call the customer and we send SMSs to the customer within 1 week of purchase to just correct if the product is correctly installed. And then on a yearly basis, we reach out to the customer to check if they're still using the product. and then we remind them to replace it as well. So that's one way, and the other way is that the package contains of a brush and an indicator, so if the filter stops working because of the water that's too dirty, these pores will get clogged. So you scrub the filter to open up the pores. And now with this indicator, you can measure whether the product is still good or not. So this product is good, but if you can move the indicator over it like this, then it has to be replaced. So that's the mechanisms that we have built in.
So this is a worn out filter. This is a similar filter. So this is the indicator if this is new and if it's worn out and this fits over, it's time to replace it.
Okay.
That lady there has been.
That really helps. So just housekeeping, we're approaching 3 o'clock. We'll be cutting into your break and coffee time if we keep going. So we can continue the discussion. They'll remain here, I'm sure, for additional questions. We'll just keep going. And if you folks want to use yourself, feel free to use the back door. Question.
Okay, my name is Vivian. I'm from Kenya, but I'm here on behalf of the University of Alabama. Now, an observation first, then just a simple question. You talked about statistics and you mentioned something about the nets. The nets failed to work in Kenya because people are given the internet, yet they didn't have beds or a place to have the net. So if you don't have people took them and used them for fishing or something. Now, I have a research interest in the arid and semi-arid area. 80% of Kenya is arid. Here we're talking about urban and rural. Now, it is easier to reach the rural areas that are not arid. There are places in Kenya, like in the northern parts, that are not accessible. We are talking about household water treatment sector. Yet in those areas, they don't even have water to treat it. So the filters may be provided, there may be subsidies or whatever it is. But as long as there's no water to treat, the filters become useless. So I think as part of the suggestion, is first to try and bridge the gap between the people who can access water before we start talking about treating this water to have safe drinking water. The other thing you also talked about was the issue of water bill and including these things in the bill. Now, 90% of the rural areas in Kenya, 95% do not have pipe water. We only have pipe water in cities and majorly Nairobi, Kisumu, Mombasa, and other cities. So when you talk about water bill, it appears to me as if you're targeting, just a certain segment of people. So to me, I think a place like Kenya should be dealt with depending on the region. And if you try to give out the filters, there's a disparity now. They will have the urban, the rural, and the poor. I don't know whether to call them poor or rural. I usually refer to them as low income rural assets.
Yeah.
So I think these people should be treated differently from just the rural population in places like Kenya.
Okay, so there were a few questions in there. One of the things you talked about, Marcio, in your presentation was the multi-barrier approach. Yes. And the first block in that multi-barrier approach was water supply, right? So you really need to understand the context in which you're working. If folks don't actually have access to water, there's a bigger issue to deal with than treatment of the water at the point of use.
You want to go for it? I do not agree.
Okay.
I don't know any person in the world that does not drink water. Do you know? Everybody drinks water. So it's basic, of course. I have been in Kenya.
That only drink Coke, apparently.
There's some people that only drink beer. In the Middle Ages, people drank beer in Holland because it was safer than water. But the logic is everybody in the world drinks water. So make sure that water that you drink, whether it's half a liter, 2 liters, 3 liters, it doesn't matter. That water is safe to drink. And that's what you can do with a filter. That's one. Then you mentioned the bed nets. I know there's many failures, but we have learned from the bed nets and we can learn from this. So in some places it did work. In many places in Tanzania now you can buy bed nets where you could not buy them 20 years ago. Right. So again, we can learn and we can improve. Those were my 2 things.
Thank you. Thank you, Hank. So we're now at 3 o'clock. Are there any other questions? The audience, yeah. And then Mark, we will come back to you. Okay.
I'm Teddy Ann Galligan, water science educator. And I'm not a marketing person, but I'm very interested in the idea of vouchers because I think this engages people that are going someplace, so they'll know the next time where they're going to. Also, if there's a few choices, it gives folks who are usually somewhat disenfranchised agency and choice, right? And it could also engender a little bit of conversation inside of a neighborhood, which filter which options are better that make people analyze and see what suits them better. So I like the voucher idea. I also wanted to read about it, and I have no experience with this, but there were the old-fashioned Tupperware and Avon lady model in North America, where women sold to women, and there were. Is this something you're using at all, or I could imagine?
Before you take that, I just want to hear Mark's question as well, and then we can see if we can do both.
Sure.
So my question has to do with the presence of HWTS and its marketing and communication in global and regional and local non-governmental organizations. Since that's one of the big sources of involvement with the poorest of the poor, what fraction of those are actually promoting health and safe storage? And is that part of their marketing campaign? And might that marketing be pitched in such a way that it would raise money for HWTS? And how many of those NGOs are part of this HWTS program that's been created? So that's a whole potential group of organizations really better connected to what this group is collectively and to actually encourage them to promote HWTS. They all promote other wash things and among others, but this is something they shouldn't be promoting, and if they're not, how can this group encourage them to do?
Perfect. So we have a question about marketing practices by women towards women for Nazava. And we have a question here about ways maybe in which the household water treatment network can monitor investments by NGOs in resource limited contexts, because they are contributing to the 8 billion. Think about it, right? So Nazava.
Yeah, interesting about the Tupperware and the Avon parties. Yes, we have ventured into that direction, but suddenly we got like really busy with the agent and the reseller and the sub reseller and the sub reseller, and then how all that commission was like divided. And we also realized, like, if you want to go really deep, actually you almost probably have to double the marketing cost and the price of your product to ensure that all these ladies down the chain actually are still happy and, you know, earning something of it. So we have actually come back from that, and now we work with resellers. So these are mostly women that like our product, and then they're like, okay, I like to sell this in my community. But the problem is most of these women, they don't have the upfront costs to invest in stock. So what we do, we write a profile of them and we upload that to Kiva. And Kiva is an online lending platform here in the US. And Kiva should win the Nobel Prize for Economy. Because when we upload a profile of our female resellers on Kiva, within 24 hours, her need for like $1,000 is already fulfilled. And once her profile is fulfilled by all these generous people here in the US, we ship our product to the reseller. She sells the product in her community. She pays back to us, and we pay back to Kiva. And we have already provided like over $300,000 through this system. Yeah, and we have provided over 350 loans to women, like to empower like their local business distributing water filters. So it's not really the Avon model, but no, yeah.
That's it. Thank you. So we're going to move to the second question, and then we'll wrap up and we'll release you from this room. So the second question was from Mark. He was asking, you know, I'm going to rephrase it, but basically the household water treatment network, could it monitor the funds that are being invested by NGOs that are part of the network to reach populations, because that money, if you think about it, is going towards the 3 objectives: advocacy, awareness raising, reaching underserved populations, and could be counted towards the 8 billion and could help to mobilize additional investment. What do you think about that?
Sure. My name is Sunil. I work for CAWST. I'm a colleague of Marcio. And along with Marcio, I will be coordinating the global network from now onwards. Certainly, network is nothing but the members. Once members, share that information with the network. And once we make our network more robust and strong, where, number of implementers come together, certainly this information is shared. When it is shared, it can be pulled together and can be, once again, the summary can be promoted part of this, and we can monitor, how much investment is going in, who is spending where, what is the impact, etc.
I'm also suggesting that the other NGOs that are not part of your network already should be made aware of this group and invite them to participate, because they could bring more money.
Exactly, and that's exactly the purpose of the network, right? Is to reach these sorts of stakeholders.
Conversation is none of them want to fund us.
Okay,
Some of the conversations I've talked to all of them, they don't fund water. And that's the element. And that's the element of why we're trying to have.
I love that you wait till 3:10.
To say that.
Continue the conversation. I think that's a really, really good point. But there is an organization at the table that is clearly having water filters funded. So I think
Yeah,
you
but
need to
only-
talk and figure out sort of where's the disconnect.
But only 20, but only 20, and only 23% of our funding that we have raised is money actually dedicated to WASH. Our funders, our investors care about women empowerment, improved health, reduced CO2 emissions. But we are not, the money for SDG 6 is going to the pipes. It's not going into market-based solutions.
Yeah.
Okay,
Sorry for that.
so I think we're gonna wrap up.
Yeah, I think we're done.
But we are here, Marcio, and we are here for next 4.5
Yeah.
days. We would like to certainly catch up with you guys, meet in the corridor and discuss about this. Hank, Lisa, you're also here for next 2-3 days, yeah?
Yeah.
We are here till Friday.
Yeah.
Yeah, all week, yeah. Thank you, everyone. Yeah.